In the last chapter, we discussed extremity injuries. In this chapter, we're going to discuss how to splint a lot of these injuries that occur to the extremities with the shoulder, the arm, upper arm, lower arm, wrist, um, and also for the lower extremities as well. But rather than going through each slide and just, discussing how to splint all the different parts of the body, what's best is for you to read the slides and to read your chapter and to actually practice each of the anatomical parts of the body and how to apply a splint to each one. So if we're splinting the extremities, there's usually an injury that occurred and it needs to be stabilized. And that's the purpose of having a splint, so that you can minimize having further injury by holding that body part in place and preventing movement. All fractures should be stabilized before a person is moved. And, one of the good things about splinting is it helps to relieve pain. It prevents damage to the muscles, nerves, and vessels. It can prevent a closed fracture from becoming an open fracture. It reduces bleeding and swelling, and, it prevents the fractured bone from moving into the soft tissues. So there's different types of splints. There's a rigid splint. It's very inflexible and it's to maintain stability. It has to be long enough to secure above and below the fractured site. There are soft splints. You can use a pillow, for example, and you can use that on your lower leg and on your forearm. A self splint, or what's called an anatomic splint, is when you actually use your body as a body part as a splint. So if you have an injured finger, you can actually tape it to a finger that's not injured, and that would provide a splint for the injured finger. When you have any fracture or dislocation, it needs to be stabilized before the person can be moved. So you need to cover the open wounds with sterile dressing, use the mnemonic CSM, and check for circulation, sensation, and movement. If pulses are absent, line up the fracture, don't force anything into position, and warn the person. Use the rule of thirds if the injury is located in the upper or lower third of a bone. Extend the splint above and below the joint. If the injury is located in the middle third, stabilize the joints above and below and place the injured arm in a sling. If two first aid providers are present, one should support the injury and minimize the movement of the extremity. When possible, place the splint materials on both sides of an injured part. Apply the splint firmly. Don't restrict blood flow. Use the Rice procedure, but do not apply ice if a pulse is absent. Seek medical care for an open fracture, dislocation, any joint injury where there's swelling and deformity, tenderness, and if the person is unable to walk or bear weight. If you hear a snap, crackling, or pop, if it's hot and tender or swollen or painful, if you're not sure whether or not the bone is broken, or if there's lack of improvement, you need to seek medical care. So when you are trying to provide some type of immobilization or stabilization, you can use a sling, and you can use an open triangular bandage, and a folded triangular bandage can also be used in conjunction as a swathe in conjunction with a sling. So in the remaining parts of this presentation, you'll see that there's different ways to apply a sling to different parts of the body. So first you have to learn how to do the upper arm, forehand, and wrist. And pictures are in the slides to show you what to do. But again, as I mentioned, you should really try and actually do this yourself. Read the directions in your textbook, on the slides, and also look at the pictures and then try it. For example, in this one, there aren't any resources available, and the person is going to use a necktie or a belt or their own jacket to provide a sling for the arm. The shoulder has a different way to, attach the sling. So, look at that. look at pictures on for the humerus splinting, and also for splinting an elbow, whether the elbow is bent in a bent position, if it's in a straight position. There's different ways to splint. You can use rigid splints, you could use soft splints. The wrist, hand, and finger splinting is a different method. So again, read about it, look at the pictures, and try it yourself. Pelvis splinting, femur splinting, splinting a knee, whether it's straight or whether it's bent, is another way. There's a way to splint a lower leg, and it could be rigid splint, could be soft splint. And there's also ways to splint your ankle and foot, and different procedures for each one. So again, the best way to learn is by doing. So, read about it, but just reading or listening to me telling you what to do is not going to be the same as you actually practicing it. So I suggest that for each one of these body parts, you practice, using some type of a splint, and have a person that can be your model, a person that can be your patient, so to speak.